Hello, and welcome to the American Heart Association's first ever Health Justice Roundtable. Tonight's discussion is the first of two Empower to Serve live roundtables being held this week focused on health justice and inspiring thought leadership, conversation, and community transformation. My name is Angela Watson, also known to many as Uptown Angela, Executive Vice President of Programming at iHeartMedia, also on-air personality for iHeartMedia New Orleans, and I'm going to be serving as your host this evening. We're here tonight because for far too long, structural barriers in society have led to a public health crisis that has taken a painful and unacceptable toll on the health and well-being of people of color in this country. The American Heart Association is committed to confronting and eliminating these barriers to achieve equitable health for all. We're going to cover all of this and more over the next hour. I have an outstanding group of Empower to Serve and HBCU scholars here with me today. Empower to Serve is an American Heart Association initiative that accelerates change in education, business, and communities to help to overcome structural racism and to achieve health justice. The American Heart Association's HBCU Scholars Program supports accelerating the development of Black scientists and healthcare professionals through direct participation in scientific research projects, exploration of careers in healthcare, and mentorship, which is so important. Before they introduce themselves, I have a task for you, our audience. We want our viewers to get involved because we want to reach as many people as possible. So first, I need you to hit the share button or start a watch party, whichever is easiest for you, so you can share this stream with your friends and your family right now. Let's meet our panelists. I'm going to ask each of you to introduce yourself, and as part of that introduction, I'm going to ask you two things. First, what inspired you to take the direction you have for your educational and your career pursuits? And second, at what point did that happen? First, I'd like to introduce to you Alana Barr. Hi, Alana.
Hi, good evening.
Hello. So I'll repeat the question for you. What inspired you to take the direction you have for your educational and your career pursuits? And second, at what point did that happen?
So my name is Alana Barr, and I am a junior at Georgia Tech, studying public policy with a minor in health medicine and society. So to answer your question, I actually used to want to be a doctor growing up the entire time. I used to want to be a pediatrician, an oncologist, etc. But it wasn't until I got to college that I really realized that my passions lie more in public health. And so I want to go into global public health in my career. But really my freshman year is when I got to Atlanta, and I was like, whoa, these people live so differently than I live in the suburbs of Atlanta. And I want to do something to help them. I want to do something to change the world. As Mahatma Gandhi used to say, be the change you wish to see in the world. Mm-hmm. And so I really take that quote with me everywhere I go. And because of that, I started the Junior Healthy Heart Coalition my freshman year in college. And since then, I've always just had a passion for helping people and giving back in any capacity that I can.
Thank you. Thank you, Alana. Next, I'm going to ask the exact same question to Asia Woodard. Good evening, Asia.
Good evening. So my name is Asia Woodard. I'm a junior health science major at Spelman College. And to answer your question, I have grown up always being told that as a Black woman, I need to step forward, I need to step up and take my place at the table. It's been something I've been hearing for forever. And I need to take my place so that I can help out the people whose voices have been ignored. And through all the things that I've seen, my mother is a physician, so I've been really close to seeing the things that she does. She worked at Charles Drew Health Center in an underserved community in my hometown. And seeing that, being there with her made me realize that I wanted to continue to carry the torch of what she's been doing and make it my own. And it's really become prevalent to me moving forward and coming into college and going to Spelman, which is in the west end of Atlanta. So it's more where more of the minority population is, and it gave me a chance to see what I need to do, where am I needed, and it's kind of helped me find my passion in that way.
Wonderful. Thank you, Asia. Next up, our scholar is Dontrez Johnson Jr. Hi, Dontrez.
Hello, hello. Well, my name is Dontrez Johnson. I'm actually a recent graduate of Tennessee State University, and I am here in Marion, Alabama, very rural area, doing a postbac fellowship. And what kind of gave me my direction for where I wanted to go with medicine and kind of put me in this pursuit is just being in an environment that I was in growing up. I've seen a lot of people in my community that were struggling with different health issues that kind of were more prevalent in minority communities, kind of all over. And so that kind of propelled me into doing what I want to do, and actually seeing some of my family members struggle with these things kind of showed me that I kind of really want to get into this field and just research it a little bit more. And you oftentimes will see people of color not trusting doctors that didn't look like them. And so that kind of made me feel like, okay, I could be that change. And I didn't know anything about college. I'm a first generation college student. Most of my family has just grew up and went straight into the workforce. And so I just wanted to be the change that I wanted to see, and just kind of put myself out there and just say, if I failed, at least I tried, So.
Absolutely. I love it. Love the suit and tie too. Next up, we're going to introduce to everyone our scholar, Jamel Fowler. Hi, Jamel.
Hey, everyone. So my name is Jamel Fowler. I'm a 2018 graduate of Fisk University with my bachelor's in biology, and I'm a 2020 graduate of the University of Southern Indiana with my master's in health administration. And my biggest, influence to kind of my educational pursuits was kind of the community I had growing up. My parents didn't have the opportunity to go to college, and they sacrificed a lot for me to be where I am today. So that's something that I'm very grateful for. And what influenced me to continue along that path was my introduction to the HBCU Scholars Program, actually. I had the opportunity to work at Vanderbilt University Medical Center, and that kind of really influenced me to want to pursue my career as a researcher. So, yeah.
Okay, awesome. Thank you, Jamel. Next, I want to introduce Ms. Caitlin France. Hi, Caitlin.
Hi, Angela. Thank you so much for having me this evening. I'm so excited to be here. I am a senior studying biochemistry at the University of Minnesota Duluth campus, and next year I will be a first-year pharmacy student also at UMD. And I, growing up, did not think that I was going to be a doctor. I didn't think I was going to be a scientist, thought I was going to be a teacher like my mom. But I actually stumbled into biomedical engineering. I remember watching a video for medical bracelets and thinking you only get 4 lines of text in order to help someone. When our ambulances in rural communities take more than half an hour to arrive, it's just not feasible for that amount of information to be helpful. And between that and the inspiration of the words of my teacher telling me, if you believe you can make the world a better place, why aren't you doing that right now? Really spurred me to pursue a now 6-year-long interest in biomedical engineering and hopefully one day rural healthcare.
Love it. Thank you so much, Caitlin. And we also have Lady Dorothy Avila Ellie. Hi.
Hello, everyone. Good evening. My name is Lady Dorothy Ellie, and I'm so honored and humbled to be here today. I'm very happy that I'm with outstanding and amazing scholars in this call virtually, of course. So I'm currently a sophomore at the University of Arizona studying public health and speech, language, and hearing sciences. And I'm currently taking this path because other than my majors, I'm also a first-generation student. I'm a first-generation immigrant as well. And with that, I'm from the Philippines, so I was born and raised there, and you can definitely see the health disparities, especially in rural and remote areas in the Philippines. And so growing up and seeing all of that, I became very passionate in public health at a very young age. And in the future, I would like to work with international humanitarian organizations to bridge that gap and change the healthcare scene in many rural and remote areas around the world.
Nice. And I love your name. Lady Dorothy, I love that. Last but not least, we're going to throw it to introduce you to Nak Wong. Hi, Nak.
Hi there, Angela. I'm glad to be here. My name is Nyam Vung. You can also call me Nok. I'm a junior at Wichita State University studying psychology, public health, and economics. My family came from Vietnam. My father in particular, he was a refugee, left Vietnam before the fall of Saigon. And my mother, she gave up her dreams of becoming a doctor in order to take care of her younger siblings after my grandfather and my grandmother were arrested. So, when they came to America, they achieved the American dream, worked hard, raised a family, got a home. But the reality is that the American dream is elusive for so many people, for so many communities. And it's this realization that to address issues facing communities of color, to address issues facing young people, we have to not only involve them, but more importantly, have them be at the head of the table, have them be at the forefront of these efforts that, really drove me at a young age to, be involved in efforts to achieve health equity and justice within Wichita. After college, I plan to become a clinical psychologist, commission, and then eventually work on health equity policy. But with that being said, glad to be here, Angela.
Oh, we're glad to have you. And we haven't even really gotten deep into the conversation yet. I'm already inspired. So hopefully all who are watching are feeling the same way. We've got such an amazing group of young leaders here who are going to be talking with us on this panel tonight. So without further ado, let's get started with our first topic. Now, naturally, the topic that we're going to start with is related to COVID-19. But tonight, we want to touch specifically on its impact on mental health. Nak, I'll start with you. Tell me, how are you and your peers managing through the pandemic?
To say that the COVID-19 pandemic has had an adverse effect on the mental health of children, adolescents, and young people, that would be an understatement. It's reflected in significantly higher increases when it comes to stress, anxiety, depression, psychological distress, and suicidality. With reference to the loneliness and the isolation, fears about how this illness, this virus, could affect ourselves and also our loved ones, and just in general the uncertainty of the reality of this country, of this world we're in. It is a bit scary. I'll be frank, but we have to be transparent about the relationship between COVID-19 and mental health. Because with that transparency, there comes an opportunity for us to address that relation, for us to address those issues. And with that being said, I have the utmost respect and admiration for our fellow HBCU scholars and EmPOWERED to Serve scholars. And the COVID-19 pandemic, it definitely affected everyone's efforts, but it hasn't stopped. It hasn't stopped it. More so or less, we've responded, we've adapted to changes with the pandemic to ensure that while we're still abiding by COVID-19 mitigation reduction strategies, we're also still striving to achieve health equity and health justice in our communities. And through it all, the work that we're doing, at the end, we also still have to be cognizant of our own mental health. So extend grace towards ourselves and to others, and to also practice self-care as well.
All right, thank you, Nak. Lady Avila Ellie, what would you say? What would you like to add to this?
I definitely agree with what was said earlier. I would also like to add, based on personal experience, I am a peer mentor at the University of Arizona for the PATH program, which is for honor students, and also for TRIO ASIMS, a program for low income and first generation college students in STEM and STEM related majors. And I can definitely say that as a peer mentor, all of my mentees are stressed, and it affects everyone. It doesn't matter if you are a first generation student. It doesn't matter if you are an honor student. It affects everyone. And it doesn't even matter if you're a professor at the university. You can definitely see the frustration in their faces as you're sitting there on Zoom. It's a very toxic environment that we're living in today. And, people are saying that this is the quote unquote new normal, but it's definitely something that people have to adjust quickly to. And it's not it's not something that you can easily tag as a new normal when everyone is still currently struggling and not they haven't adjusted to the current situation yet. So that is my response based on my personal experience.
Wonderful, and good for you for being a peer mentor. Let's take it a step further. Now, we know that people of color in the US have higher rates of getting COVID-19 and dying from it, unfortunately. Lady Avila Ellie, tell us your thoughts on the need for addressing mental health.
Definitely. Thank you so much for that wonderful question. I think with people of color, if you look at the numbers, if you look at the data, the statistics in public health classes, it's always people of color and Black people are more likely to. They have higher percentages of. It's always that. And so I think with the recent numbers that I saw with the CDC, Latino and Hispanic households and American Indian households or people are 2.8 times more likely to get COVID. With Black people and people who identify to be African American, 6 times higher. And so I think that about that with regards to COVID-19 affecting people of color and Black people in general. And with that said, it's a different, people of color and Black people prioritize different things, and we have different privileges as well. For POCs, it's more of, we work in the service industry. We are essential workers. So the schedule is not very flexible when it comes to that. We have to work, we have to put food on the table. And when we come home, we live with our extended family. And that increases the risk if you live with more people. It's not just you and your kids if you're a parent. It's you, your kids, and your grandparents, and even your aunts and uncles. So that says a lot about being a POC and being a Black person living in this generation during a pandemic. With the other concern that you raised about mental health, it is true that COVID-19 affects people of color more during this pandemic. And that's, as I said, absolutely true. It starts with, it has already happened before. We don't necessarily open up conversations about mental health when we're in households of color. I think that's
ashamed of it. Exactly.
Yeah, there's a big taboo about it. So during this time, it's definitely high time to open up these types of conversations and talk about very intense and serious topics with family members.
Okay, thank you, Lady Avila. Nak, how would you respond to that same question? Why is it so important to address mental health, especially for people of color?
Social determinants of health and structural systemic barriers in general, they play a crucial role in the fact that Black, Indigenous, and other communities of color, as Lady Ellie was saying, that the fact that they have less access to healthcare and mental health care, and when they do have access to healthcare, and specifically mental health care, it's typically lower quality. Mm-hmm. And as we know, lower quality of healthcare, less access to healthcare in general, it often translates to poor health outcomes for communities of color. And another point I'd like to make is, the role that systemic racism has had on our country, especially with reference to health, with intergenerational trauma and trauma in general, for Black, Indigenous, other communities of color. We have to raise conscious awareness of how America's original sin to this day affects the health care and affects the health outcomes of people of color.
Absolutely. Thank you, Nak. Caitlin, I know that you had some thoughts on this topic as well, so I wanted to give you an opportunity to weigh in here. What would you say?
Yeah, absolutely. Mental health is something that's really been weighing a lot on my community, as we are, again, an incredibly tiny community. So when we experience loss, when we experience trauma, when we experience all of these things that are so common and prevalent with this pandemic, it tends to impact us harder, and we kind of ball into ourselves tighter. And as hard as this is on everyone, my hope is that we can work to build some resiliency, that we can have the ability to turn to each other, that we can go to those people who understand what we're going through. And together, by raising that awareness about mental health, being able to branch out and communicate all of these feelings, that even if it's just my community, other communities similar to mine are experiencing the same things. And together we can move a conversation that can bring healing.
Absolutely. Thank you, Caitlin. Now, Our mental health is so important and something I don't think any of us really focus on as often as we should, as some of you, the scholars, have mentioned. I'm really glad that we had a chance to touch on this today, and I wish that we had more time. But right now, we're going to go ahead and move on to another topic. We know that about 50 million people in the United States are at risk for cardiovascular disease because they lack the most basic needs: healthy food, clean air, drinking water, quality education, employment, and housing. There's so many stats around the social determinants of health, but one that always stands out to me is the notion where you live can have a direct impact on how long you live. Research shows that life expectancy can differ by as much as 20 years for people living just 5 miles apart. Can you believe that? 5 miles. Jamel, tell me why health justice is so important to you.
So yeah, health justice is actually extremely important. To me, health justice is important because it gives everyone a fighting chance at life. And nationality, ethnicity, race, none of that should determine whether you live or die. And even like you said, the whole idea about zip codes and you living 5 miles away could determine whether you live or die. So when I think about health justice, two terms come to mind, and that's health equality and health equity. So health equality is when you kind of give everyone the same opportunity and you're trying to make it even across the board. Whereas health equity is where you try to level the playing field. And health equity is what we should strive for because not everyone needs the same thing to achieve better health outcomes. And when we look at the Black community, you see that the Black community is who is riddled with diabetes, who has hypertension, and even some of the statistics that you mentioned earlier. And so until we see these numbers decrease and that Black people have this fighting chance, then we're not achieving health justice.
Thank you, Jamel. Asia, what would you say? Why do you think health justice is so important?
Health justice is important to me because it has such a personal correlation to my life. It's easy to say, oh, Black people have a higher rate of this, and Black people have a higher rate of this. But for me, I see it every day in my own family and my own community, and it's different. It's more important to me. It touched closer to home, and it's really what has made me want to get my degree in medicine and then work in underserved communities. I want to be able to be a familiar face to my patients. I want to be able to have that trust, that patient-provider relationship that a lot of people lack because of, one, there's not health equity. So they're like, are you even looking out for me? And I want to be able to look out for them. It's important and it's needed. Health justice is something that hasn't been talked about enough, and it needs to be talked about more. And I think now is a good time for us to talk about it because as we see now, Black people are dying at higher rates. People of color are dying at higher rates. We're getting infected at higher rates. And not only just dying, but COVID has long-lasting effects. So just being able to contract it and at such a high rate is dangerous, and it's a problem, and it's something that needs to be fixed. And so that's why it's so important to me, not only because I see it every day, I see it in my own family and I see it in my own communities, but because it's something that I want to change for the future. I'm a Black woman, so my children are gonna be Black, my other family members are gonna be Black, and so I want to be able to make it better for them.
All right, absolutely. Now we could talk about this, for hours. I definitely want to touch on solutions and ideas for how we can create the change in this area. So, Alana, I want to go to you for a moment. How do you think we can achieve health justice?
I first wanted to start off acknowledging a lot of what my peers said previously, especially Knock. I like that he mentioned social determinants of health. I also wanted to include the socioeconomic status and taking into account a person as a whole, their religion, their educational attainment and achievement, opportunities available to them in their respective location. These in conjunction, as well as environmental racism. So where are chemical plants being built? Where are these new factories being, all these need to be taken into consideration when looking at health justice, I think. But also going into solutions. I think we need to go and speak to constituents and citizens directly, making sure that we're electing public officials who actually hold the same or similar ideologies, and they're able to actively communicate what we need at whichever level, so the local level, state level, or federal level, and keeping them accountable as well. I think that's a very big issue. But all of this in conjunction, I think I'm humbled and hopeful that Gen Z, our generation, is able to hopefully one day be in those positions and again, be the change that we wish to see in the world.
Wonderful. Lady Avila Ellie, what would be your answer to this question?
Two things. First thing would definitely be something more simple. Actually, both of them are more simple. First thing would be to educate yourself. That is where health justice happens. That is where health equity exists. Once you educate yourself, what does it look like? Reading about the Flint, Michigan, the water crisis that happened there, and learning that water is not safe for all communities, especially for communities who are communities of color. And who come from low income backgrounds. Why is it so easy for them to switch to a different water source just because, you know?
I think we may have lost Lady Avila just for a second. Can everybody?
So educating yourself. Listen. Sorry, am I back?
You're back. Welcome back. You were saying.
Okay. So as I was saying, educating yourself, reading that book, listening to that podcast, doing everything to educate yourself about the health inequities happening in the world. Second thing is this, what we're doing right now, seeing and acknowledging the scholars, especially from this generation, as Alana said a while ago, who are doing a lot of good work in the community to carry out health equity and to make sure that people are fed, that topics about health inequity are being addressed, holding people in your local government accountable, simple things like that.
Wonderful. Thank you, Lady Avila Ellie. And before we move on, would anyone else like to add something to this? Caitlin, would you like to add something to this?
Sure, I'll jump in here. I think one of the things that's been really critical as of late too is understanding which voices to amplify and when to use your privilege, especially as a white passing person. It's so critical to understand that even though I come from a community of color, that does not mean that I should be the voice speaking. It is so important to push these voices forward and to understand the issues from a personal standpoint, but to be able to amplify these critical voices, especially in situations like these.
Thank you, Caitlin. And to add to what you just said, we're going to go to this. The American Heart Association is dedicated to exposing and eliminating structural racism. It's a public health crisis that can significantly damage physical and mental health and perpetuate disparities in access to healthcare, education, income, housing, and several other factors vital to healthy lives. Discrimination is one piece of that. Because we have our scholars here, I want to talk about education. Dontrez, how can we break down barriers in education for students of color to pursue careers in research, medicine, and in healthcare?
Absolutely. Thank you for that question. That's a great question. I feel like the first and foremost, you have to have the opportunities and you have to have the exposure. Without the opportunities or the exposure, you will get nowhere. I also feel like that employing individuals that look like the individuals that you're trying to reach is a major part of it. It's sort of like, you know, coming into a community that you're not familiar with, or like, you know, sort of like someone from Georgia being in Texas or in somewhere else where they're not from. It's kind of like you stick out like a sore thumb and you kind of know like you're the outlier. And so having that relatability with someone that looks like you is something that's so major. I also feel like if you go into these communities that have different pipeline programs to kind of get students engaged, I know like more so when I was younger, there were a lot of scientific camps coming around throughout different schools, and you kind of don't really see those things happen as often. And so those are some of the things that I actually got, my mother got me engaged in growing up, to kind of get that exposure to me, to kind of let me get outside of my box, get outside of my comfort zone, to know that, you know, you can do these things are out here, these things are accessible and very much so attainable. And I think that's probably a major part of it.
Thank you, Dontrez. Jamel, I wanted you to weigh in on this as well. What are your thoughts?
Yeah, definitely. To add to what Dontrez said, it comes around to making things attainable, and a lot of it has to do with money. So a lot of students take out student loans to go to college, but at the end of the day, they take out these student loans with hopes to pay them back, but they're unemployed. So what do we do when we're unemployed? We don't have the money to pay back these student loans that we took out. You know, we can't depend on our parents forever, even though they're there to support us. We just can't depend on them for everything. And another thing is when you look at that, like I guess, past undergraduate level. So graduate studies, you have to take the GRE, you have to take the MCAT, you have to take the pharmacy school exam. And when you look at these cost money. A lot of Black people don't have the money to pay for these. So they should never have to choose between, am I gonna pay for my application or am I gonna like buy my next meal to eat? That should never hinder someone from attaining their education, because education takes us everywhere in life.
Absolutely. Thank you. Asia, I'm going to go to you next. What is cultural competency and why is it important to achieving health justice?
So thank you for that question. Cultural competency is developing an understanding and appreciation for the differences in culture, but understanding them, knowing that different cultural, not religions, excuse me, the different routines, the things that different cultures undergo, and to understand and kind of make connections between that, because without that, it's hard to make connections with your patients, with the people in your communities, with someone who may live next to you. Without having cultural competency, it's really hard for you to understand what the people that are different from you need, because how can you understand what someone who's a person of color needs when you don't understand what their culture is? You don't understand what their day-to-day life is like. You don't understand what is a part of their culture and what they need to do or what they have to do or what they want to do to be able to live their lives and go day to day. So it's really important to have cultural competency, to understand it, to kind of teach other people about it, not to just, know for yourself, but also to educate your peers and educate your doctors, your teachers, your lawyers, really anyone and everyone has to understand cultural competency to expand your worldview, to expand your community view, to understand that who the people are around you and how you can bridge the gaps that may be between you. And that's kind of what health justice is. It's to bridge those gaps and to kind of make sure that there's not any more gaps. And to be able to do that, you have to understand their culture and you have to understand why people do the things they do. I'm not saying you have to do what they do. I'm not saying that you have to, but to appreciate, to understand, and to be sensitive is necessary. It's something that you need.
Good point. Thank you, Asia. Dontrez, what would you say to that? Why do you think cultural competency is so important to achieve health justice?
Well, I would say, cultural competency is the ability to understand, communicate with, and effectively interact with people across cultures. And I would say that it kind of teaches you to be aware of one's own worldview. It also develops a positive attitude towards cultural differences. And you also gain knowledge of the different cultural practices throughout that process. So I would say having cultural competency actually gives you the ability to kind of get rid of those implicit biases. So once you get rid of implicit biases, you will be able to, you won't have those judgmental thoughts. Or like, if you see someone of color, you think this about them, or if you see someone with a turban on, you think, it's from, you think terrorists or whatever it may be. So if you get rid of those implicit biases, you kind of have a true judgment of your character and of that person's character and culture as well. And that brings about equity overall. And that's how you can get rid of those things within the healthcare system, within education, and just overall to make the world a better place.
Thank you, Dontrez. Hot topic tonight, cultural competency. I'm learning something about this myself. Nak, I want to throw it to you. Why do you think it's so important to achieve health justice with cultural competency?
First, I want to thank Asia and Dontrez for sharing your answers. I got goosebumps, to say the least.
Sure.
From my perspective, the importance of cultural competency ultimately boils down to the reality that you and I and just about everyone else, we have different lived experiences, but these differences in lived experiences, they should not be they should not be a barrier. They should not be a divide. They should not be a gap in terms of how we see, perceive, and treat, and really support each other. And from my understanding, and just from my perspective, cultural competency, it doesn't just address health disparities and health inequities, but addresses the why. Why are these issues in the first place? And it's through that why that we can truly amplify voices, underserved, unusual, disenfranchised voices, and in the process of doing so, try to help better achieve and attain health equity.
Thank you, Knock. This conversation, I can't say, I mean, it's been mind-blowing. We've had such great conversation here tonight. I'm sure our viewers are in agreement with that. I'd like to ask 3 final questions to you, our scholars, and I want to open it up to the group to make sure that everybody's going to have a chance to add to this conversation. So here's my first question. We'll go to you, Knock. In your experience, how have you seen structural racism impact the education system?
That's a very great question. And, there's a lot of research that corroborates and indicates, the school to prison pipeline, but just, speaking from personal experience, my Black peers, fellow Black students, for the same behaviors that say, a white student or another person of color may exhibit, they would typically receive much harsher punishments, receive much harsher discipline. And I think, just this reality that from the moment people are born, that there is already this intense, immense weight weighing down on them, and thus their outcomes, that it's very concerning for me. And I know that, despite being a person of color, I have privilege in the sense that society does not subject me to the same biases, to the same forms of discrimination that other people of color experience. So, and it's not just the school to prison pipeline, there's also the foster care to prison pipeline. And there's just a lot of work needs to be done, but I'm confident that this group can help address that.
Definitely. Thank you, Knock. Alana, I'm going to throw it to you next. Same question. Have you seen structural racism impact the education system?
I definitely think growing up in the suburb of Atlanta and then moving further into the city, it's like night and day, basically. I grew up in a white community, elementary, middle, and high school. The way I was treated, I was called an Oreo, for being Black on the outside, white on the inside. Every time I would see my counselor and say, hey, I want to go to Georgia Tech or one of these really top institutions, she would say, really? We'll see about that. And so kind of just those interactions that you have through primary school and secondary school throughout your whole education, 13 years, basically, of people not believing in you or thinking that you're less than just because of the color of your skin, definitely has an impact on the way you perceive yourself, and then kind of the future and what you want to do with your life and who you think you can impact. And so I think all of that in combination needs to be changed, as Nak was mentioning earlier, but I'm very hopeful that something will change. And I also wanted to add a lot of the microaggressions. I'm not sure if that's a structural thing, but definitely microaggressions need to be more spoken about. While at Tech, people are like, what sport do you play? Or how did you get in here? I didn't know. this many people of your well, they don't say of your race, but you know, the microaggression, that there's a quota that needs to be fulfilled or something like that. And so those, again, definitely impact the way that you see yourself, the way that you maybe even get help from professors, going to office hours, attending organizations, attending meetings, etc. So I think that definitely needs to be changed as well moving forward.
Thank you, Alana. Let's get more specific and talk about what changes you'd like to see in science, research, and in healthcare. Caitlin, I'll toss it to you first.
Thank you so much for this question. In working with a lot of other Indigenous scientists, one of the things that we talk about a lot is kind of this dual pedestal of every time that an Indigenous person does something really impressive, it's great and it's talked about a lot within our community, but it's always talked about in context of Indigenous student achieves this. And what I really look forward to is a day where some of my peers are able to continue to create all of the amazing scientific advances that they're able to do without the context of who they are being put first, but the fact that their scientific achievement is what is being put first. And I think in order to do that, what we need to do is to continue to support and, as many of my peers were saying, continue to foster these opportunities for people of color, specifically Black and Indigenous people of color, to have the ability to be in these scientific, to be in these medicinal, to be in these spaces where oftentimes they're either excluded or used as a case study. And I think that is kind of the future that I hope to see.
Thank you. Appreciate that, Caitlin. Asia, how would you respond to that question? What changes would you like to see in science, research, and in healthcare?
So not to take too long, but I would like to address the first question a little bit before moving to the second question. But in terms of seeing how structural racism has impacted the education system, you can see it a lot in the way these different schools are funded. You see a lot more funding in schools that are in white neighborhoods, and then you see less funding and more students and less resources in the neighborhoods of people of color and the more poverty stricken, if you will, or underserved. I like underserved better. Underserved communities, the underserved areas. And I think that that's also something that needs to be fixed if we're looking to make changes in science, research, and healthcare, is it has to start at the education system. It has to start with you're giving opportunities, you're giving resources, and you're giving your time and your effort into the students who previously haven't gotten it and who structurally have been ignored. And I think in order to do that, you have to uplift these students, you have to uplift these people, the community, and then in that way they can come into science, healthcare, research, and make a difference on their own. But it kind of starts closer to home, and it starts way back. It starts young, but it can also be made a difference in further up into pipelines, like for science, research, and healthcare. I think it's important that we're doing what we're doing now. We're identifying what needs to be changed in terms of health justice, health equity. Without identifying what the problems are, you're never going to be able to change them. You're never going to be able to have a solution to what is the problem. So I think what changes need to be had is to give more funding and more attention into what the problems are, what are we lacking, what is causing these differences, and then so that way we can address these problems in a specific way, a problem targeting way that will make sure that our changes are made. And I think it's important to recruitment. We've seen it before, but I think it's important because a lot of the times what I've seen is, or what I hear is, as you move further up in, your education and your the kind of responsibility you have maybe in a company or at your school or your job, you see less and less people who look like you. And I think that something that needs to change is kind of maybe reaching down and making sure other people are brought up with you, so that, because you have your own story, you have your own lived experience, and someone who look like you will still have a different lived experience and a different story. It's something I've seen at my own school. I go to a HBCU and a lot of people think there's not diversity there. Everyone's Black. No, there's not a diversity, but that's because our diversity is focused on something besides our skin color. And I think that's not where diversity lies. It lies in your different lived experiences, different religions, different ways, different sexualities and sexual orientations. And I think that it's important that we base our diversity not just off our skin color, but also off of different lived experiences. But that does start at skin color, that does start at where you live, but it can move further. And I think it's important that we identify that and we talk about that and we make sure it happens.
Thank you, Asian. I love what you said. We rise by lifting others. So that's one of my favorite sayings in this entire world. So thank you for that answer. I want to ask Dontrez, same question. What changes would you like to see in science, research, and in healthcare? Another future doctor.
Yes, man. Well, Asia, that was great. You actually hit on a lot of topics I was thinking about. I kind of want to actually bounce back to that first question as well. So some things that actually happened with me, I actually went to a predominantly Black high school and I transferred to a predominantly white high school. And I also went to a predominantly white college and transferred to a HBCU. So I've had those lived experiences in both areas through both my adolescent and both like as I'm going into adulthood. And so I've seen the differences and I've seen like the funding is a major part of those gray areas with the schoolings. And one thing with me that I felt like I wasn't getting the education that I needed. I didn't have the support from the professors that I would like to have, even with me going to office hours and being an athlete and trying to make up time for assignments and with traveling and everything. So it was really amazing to see how disconnected a professor could be from you with you putting your all in. And that was just the utmost disrespect in my face, just complete neglect. And so I transferred to somewhere where I was once going to be the majority in my lifetime. At a HBCU, I felt like I could be the majority throughout the world for at least one time in my life, at once upon a time in my life. And so that's why I chose to go to an HBCU. And there, the opportunities were so readily available for me from the time that I stepped foot on campus. And also the professors sold into me. They actually wanted to see me succeed. They wanted to sow into my life and like, hey, let's help you here. Or you're struggling here, let's do this. And I kind of really seen that, just help that reaching your hand back and pulling someone along with you rather than, giving them a step stool and saying good luck, So that's something that I really cherish with my collegiate career. But the changes that I would like to see within the educational system, the healthcare system, I would love to see the ownership of implicit biases. And once you own that, that's when those changes will start to come. Because if you got yourself constricted within this certain in group, and you looking at people as an out group, you will never grow to be culturally diverse and culturally fluent, So, and that's major with education. That's major with healthcare. That's major with just sociality in general. So, I think that would be a major part of just kind of starting to change that curve and making that difference in the world. And I think you can't go wrong.
All right. Thank you, Dontrez. Finally, I want to close with some actionable steps for our audience today. So we walk away feeling empowered, feeling motivated to get involved in this very important conversation. So I'd like to start with Jamel. What is the one thing that you would like for our audience to do after participating with us tonight?
Thanks for that question. I would definitely say to seek out mentorship. You see that healthcare in general is kind of disproportionate when it comes to, different races like white, Black, and representation is key. And for me, I've had research opportunities with a Black scientist at Case Western. I've had a research opportunity with a Black scientist at Fisk. And these were some very valuable experiences to kind of encouraging me to see where I want to go. And Kamala Harris said it best when she said that you must dream with ambition and lead with conviction and see yourselves in ways that people have never seen you before, simply because they've never seen it done. And I think that seeking out mentorship will allow you to show yourself as being, minority representation in fields that were not made for us.
Okay, thank you, Jamel. Lady Avila Ellie, what would you like to see the audience to do who participated with us tonight, the one thing you'd like to see them do?
Yes, I would like them to practice a few things. First of all, we are still living in a pandemic, so take this time for yourself. Take care of your mental health, please. Second thing is educate yourself. As I said a while ago, take that time to educate yourself, even with the most difficult, quote unquote, difficult and serious topics happening with regards to public health in the world around you, of course. So take care of yourself, educate yourself. Second is to empower yourself. If you don't have a seat in the table, as people say, make your own table. Make sure that you're able to make an impact that way. And then, as Jamel said a while ago, make sure that you are able to seek mentorship. I am part of 2 mentoring programs at the U of A, and right now we don't see a lot of diversity, equity, or inclusion. So if some of my mentees are having a hard time looking for inspiration, I can't so readily say, hey, this person did this in this specific field, but at the same time, try finding that space where if people haven't achieved it before, you can do it. You can be the first one. So try finding that inspiration for yourself. And overall, taking care of yourself and taking care of the people around you as well.
Thank you. Wonderful. Thank you, Lady Avila Ellie. Alana, what would you say? Same question, the one thing you'd like for our audience to do after participating with us tonight.
You know, just to quote Nike, just do it, really. I think just to echo what everyone has stated before me, I think that if you see a disparity in your community, if you see that the kids in your community aren't given the same resources as maybe the next town over or you grew up with, you know, organize. There's so much power in being a group, in forming coalitions and forming, I don't know, study groups or whatever it may be, whatever your capacity is. Really just do it. And I promise you, your work will have a huge effect, a monumental effect on the people whose lives you're trying to change, especially if they're part of disproportionate or marginalized communities.
Love it. Thank you, Alana. Asia, what's the one thing that you'd like for our audience to do after participating with us tonight in this conversation?
I would like for them to take the time to research opportunities that will allow them to do things that they want. If this is something that you're interested in, if you're passionate about health justice, if this is something that you want to make sure it happens, then research opportunities that kind of give you the pipeline and a way into the door to be able to do such things. It's a bit easier to kind of get a handle on things that you want to do if you're kind of halfway already in the door. And it is beneficial to make your own way and to do things your way, but sometimes it can be hard. Sometimes you could be a little nervous about it. Sometimes there's people around you that are telling you you can't do it, and it's kind of weighing hard on you. So a way to make it easier, a way to make it more accessible is to find programs that are already there, and you can even branch out from those programs yourself. And so I think it's important that you research them, you look them up, you find them, you see what you can do, and identify what matters most to you. Identify what means a lot to you. I mean, I've done so, and I'm still learning how to do so myself now. And I think it's important that when you start there, you can do anything. As long as you put your mind to it, and you just have to get through that door and you have to get into it, and you can do it, but you've got to do it. So don't let this opportunity go past. Don't let this talk go past with you just saying, oh, look, what they're saying is so great. Take it a step further and do it yourself.
Thank you, Asia. Love that. Caitlin, the one thing you'd like to have our audience to do after participating with us tonight?
Yeah. I think the one thing that I really want our audience members to do tonight is to go out and say thank you. There are so many of us and all of the amazing scholars that I'm here on the panel with, you're all doing incredible work. And I think the acknowledgement of that and the support of that, and even if you can't financially support some of these programs, even if you don't have the opportunity to create these mentorships, use your voice, talk about these opportunities, share the word, and really acknowledge all of the work and everything that goes in behind the scenes to really improve health justice for everyone.
Thank you, Caitlin. Dontrez, what would you say? The one thing you'd like to see our audience do tonight after participating with us?
I would just say, just go for it. Whatever you put your mind to, go do it. It's never too late. You wake up every day and the next day is not promised. And so don't take it for granted. Make it count. That's my biggest thing. Make it count. And like, just trials are not a test of faith. You get faith. You have faith to go through the trials. And especially being a person of color, you're gonna have obstacles along the way. You're gonna face adversities, but it's about how you overcome those adversities and the character that you build and the mindset that you develop during overcoming that adversity is what builds you ultimately. So be a neighbor to your neighbor. Check in. Don't be scared to just reach out. Be a change, cause a change, and proceed to change, and let it snowball effect.
Love it. I'm going to add my 2 cents to it. I would say, honestly, we've got to look out for each other. You know, you've got to take every no and turn it into a yes. Look at what the work is that the young scholars here on our panel have put forth tonight, and the work that's still to be done. So join in and be a part of the positive change. If the biggest message, that's my takeaway for tonight. And just so inspired by all of you here tonight, how thoughtful you've been in your responses. Thank you for that. We face a lot of challenges, but we came together today to start the dialogue, to give people an opportunity to be heard, but also to listen. And I hope that all of you who are joining us tonight are leaving here with a renewed hope, a renewed spirit for being a part of the change for health justice. Now, the American Heart Association is dedicated to ensuring equitable health in all communities, and we hope that you'll join us in that mission. Don't forget, this was the first of 2 roundtable discussions that the American Heart Association is hosting. Tomorrow, award-winning journalist and television personality, one of our favorites, Roland Martin, will convene business and community leaders, philanthropists, and volunteers for a lively and meaningful conversation about transforming our communities through faith, finance, and business. You can join us here again tomorrow. We hope that you do, on November 12th, 11 o'clock Central Standard Time, 11 a.m. You can visit the live event at the page empoweredtoserve.org to register. You can also visit empoweredtoserve.org for more information about the Empowered to Serve initiative, which is our scholars program, and to view a recording of our roundtable tonight, just in case you joined us a little later. So thank you for participating tonight. We appreciate you for being with us. On behalf of myself, Uptown Angela of iHeartMedia, iHeartRadio, of our scholars, HBCU, who are representing and did such an awesome job tonight. Be safe. And again, we appreciate you for joining us. Good night, everybody.